Rhinoplasty is a procedure that we use to change or alter the nose shape. If a patient has a large hump on the nose, or they have a bulbous tip on the nose, or they have a long droopy tip, those are things that we can change with the rhinoplasty procedure.
The philosophy that I have on rhinoplasty is that the nose should be the least noticeable thing on your face. I often tell patients that in consults, and tell them that no nose is perfect, and even after surgery, perfection isn't the goal. What we want it to do is fade to the background so that we're looking at a patient's eyes or their cheeks, their lips, their other facial features, and of course we want the nose to be a really nice afterthought of, wow, they have a really nice looking nose, great profile, but we don't want it to be the first thing that anyone sees.
Hi, my name is Annie. I had a rhinoplasty. Dr. Adams, he really went out of his way to make sure I was comfortable and everything went smoothly. He talked about how he didn't want my nose to stand out. He wanted it to just blend in with the rest of my face, and that's really what I was looking for.
Hi, my name is Mia. I had a rhinoplasty. I feel like just mostly whenever I looked in the mirror, all what I could see was my nose, and I just wanted to just see all of me.
Rhinoplasty can take, on average, between 1 to 2 hours. The rhinoplasty procedure that we use is designed to get the patients back in the swing of things quickly. It's a very specialized procedure, and we do a lot of rhinoplasties here. Some doctors may do 5 to 10 rhinoplasties a year. We will do hundreds of rhinoplasties a year.
When patients ask me what's their downtime, I typically say before going back out into public around a week. But those nasal bones are going to be somewhat mobile for even up to 6 weeks.
So I don't want them to do any swimming, diving, horseback riding, being around big dogs, anything that get bumped in the nose for a total of 6 weeks. That includes putting glasses on their nose or sunglasses on their nose. After 6 weeks, the bones are solid and they can do anything they want to do.
It was super easy. The first night I stayed in Birmingham, and I actually had a nurse with me all night. And she was just there anytime I woke up.
My recovery was actually really easy. The first night, I just had to keep ice on it. I didn't really have to take any pain medicine, and it was just really easy for me.
That's always something that we think of with rhinoplasty, is really adjusting the form and function at the same time.
I'm definitely much more confident. I don't try to hide my nose in pictures or anything, and it's just really boosted my confidence.
I feel like I'm just really less worried about what everybody else sees now, just because I know I'm happy with myself.
My overall goal is, at the end of the day, 20 years after rhinoplasty, people forgot they even did it, because I want it to be something where the nose is not on their mind. It does not take up space. It is something that makes them confident, and that they're very happy with the balance and the facial features, and go on and live life, and I hate to say it, almost forget about me.